Hi, my name is Anthony Wick, and I am a future nurse practitioner, and I'm currently enrolled at Lehman College. Today, I'm going to be doing a cardiovascular and peripheral vascular health assessment to meet the requirements of my health assessment course. So this examination is going to involve inspection, palpation, percussion, and auscultation. So let's meet the presenting patient. So here again is Mr. Perez, and he is a 32-year-old healthy Hispanic male who presents to the office today with no chief concerns or complaints. Before his arrival, my assistant would have already done a vital sign check. So let's say that today his blood pressure measures 118/76, heart rate is 78, temperature is 36.8 degrees Celsius, and his oxygen saturation is 100%. Now his weight is 154 pounds and his height is 5'8". So with that out of the way, I would wash my hands, and before we begin this focused assessment, it would be important just to ask some pertinent questions that are related to the cardiovascular system. So Mr. Perez, since your last visit at the office, have you had any chest pain, any palpitations, any shortness of breath, or noticed any new swelling in any of your body parts?
No.
Excellent. So have you noticed any pain or intermittent claudication, which is best described as pain while walking, any hair loss, or have you noticed any change in color in your fingers or toes, especially during the winter months?
No.
Perfect. Okay, so to begin with the vascular exam, like always, I'm just going to begin with inspection. And generally by looking at the whole patient, including the head, eyes, ears, nose, and throat, his chest, and both his upper and lower peripheral extremities. And here I just want to note if there's any signs of distress, if the patient is breathing comfortably, and that he appears well nourished, and that he's just generally comfortable, which it does appear as so. So I would just begin with generally looking at the patient, noticing in his arms and lower legs. Can you just uncross your legs for me? Perfect. That there's symmetry, that the color is evenly distributed. There's no swelling, no venous patterns or pigmentation changes in the skin. And I can also here assess for the temperature with the dorsal part of my hand. Just noticing if there's any temperature difference, because with a temperature change, it could be indicative of cyanosis or low oxygenation and poor perfusion. Okay, so here I'm seeing that the patient's skin is clean and dry, and it's free from any lacerations or rashes, scars, or any kind of openings. His head, his eyes, his nose, his mouth, and his throat are all symmetrical, as is his chest area. And in both the upper peripherals, I noticed no swelling or the venous changes or any sort of skin abnormalities whatsoever. So looking at his head and the neck and the area, neck area, I want to begin by looking at the conjunctiva of his eyes, because with the conjunctiva, you can actually notice, it can actually tell you a lot about any cardiovascular conditions. So it can tell you if you have like a blocked artery, hypertension, even diabetes. So I'm going to just assess here. And open your eye. Right eye looks good. Left eye looks good. Okay, so I noticed that in both of his conjunctivas there were no redness or swelling, and it appeared normal. And the blood vessels in the eye also looked appropriate. So now moving on to his mouth. I want to assess the lips, just noticing if there's any cyanosis present or bluish tinge, which there's not. And also I'm going to look inside his mouth and his mucous membranes. And that'll tell me a lot about his hydration status. And lift up your tongue. Perfect. Okay, so I didn't see any signs of cyanosis. His mucosa looks healthy and pink. And he looks like he has excellent hydration status. So then moving on, I just want to look at the neck. And again, I'm just checking for symmetry, which there is. And I'm looking for carotid pulsations. And the carotid artery is both on the right and the left side. And if you would just lay down for me. Thank you. And move your head to the left. I'm also looking for jugular venous distension, neither of which I see on Mr. Perez. But if I did see jugular venous distension, it would be considerate of something like an increased pressure in the superior vena cava, and it could be a signal for heart failure. So if you notice with the jugular venous distension, I just had the patient turn and lift his head up. I have him at 30 degrees, and I have his head tilted towards the left. And again, I don't see any visible distension there. And also, if you look here, it measures about 3, usually the normal is about measurement of 3 to 4 centimeters, which it appears so for Mr. Perez as well. And you can sit up for me. Thanks. So next, I'm just going to assess his nail beds. And here I'm on the hands, so I'm just looking for any clubbing, which is an unusual curvature of the nails. I don't see that. Perfect. And I don't see that. Both nails look good. And now I'm going to do your feet after, but I'm just going to also check for any cyanosis. And his nails blanch and return to normal rapidly. So that's good. That shows good oxygenation status. So his nail beds, they appeared normal color. If they were white or pale, I might have suspected cyanosis. Or if there was any, it could also be like a sign of anemia. But Mr. Perez's nails were normal, and there was no signs of clubbing or clubbing, color change, and his nail beds returned to normal in less than 3 seconds. So all of that shows proper oxygenation status. Moving on to the chest area, I'm just going to inspect for any, again, masses, scars, lesions, any signs of trauma, none of which are present on Mr. Perez. And I'm also inspecting, if you could actually lay down again, thank you, for any visible pulsations. Now, sometimes with extremely thin individuals or children, you can sometimes see pulsations. However, on Mr. Perez, none of those are visible. And usually, like at the point of maximal impulse is where a lot of times you would see that. That's at the 5th intercostal space at the mid-clavicular line. Again, there's no signs of that being present. So moving further down, I just want to assess the lower extremities for any, again, for any clubbing, the toenails. No clubbing looks present. And again, I'm just making sure oxygenation status looks good. And while I'm here, I'm also going to check for any swelling or edema by doing an indentation test. Ooh, sorry. All right, no swelling or edema is present. So had I seen edema, I might consider something like congestive heart failure, which is one of the main causes of that. But again, his toenails, they appear normal, good oxygenation status in the lower peripherals, so all is well there. The next part of my examination, now that I've inspected the whole of the patient, involves palpation. So I'm going to palpate the carotid arteries bilaterally. Now it's really important to just remember to only palpate one at a time, because if you press on both carotid arteries simultaneously, it could actually compromise the blood flow. So I'm just going to palpate the carotid artery on this side. Excellent, nice and brisk. And I'm just gonna palpate the carotid artery here. Excellent. Okay, so I felt a normal pulse strength that was brisk and moderate intensity and equal bilaterally. Now, had there been a delay, I might think about aortic stenosis, or if it was bounding, I might be thinking of aortic insufficiency, neither of which was present. Next, in the arms, I just want to palpate, and if you could sit up one more time, I'm sorry. I'm just going to palpate the axillary and the epitrochlear nodes here in the arms. And I'm just noticing if there's any tenderness, that the nodes feel movable, not enlarged. Any tenderness? No. Perfect. No tenderness here? No. Excellent. And if you want to lay back down. And then I'm also going to be checking for the pulses. So I'm going to check the brachial pulse in both arms. The radial pulse. The ulnar. Excellent. Perfect. And I'm just palpating the inguinal lymph nodes here. Any tenderness? Great. And then I'm also going to do the femoral. Pulse. The popliteal. The dorsalis pedis. And the posterior tibial pulses. All right. So with the lymph nodes, I was noticing if there was any swelling or any tenderness, which if there was lymphadenopathy, it might indicate something like an infection. And with the pulses, I was just making sure that they were all normal, that they were present, that they were not bounding. If I was to grade his pulses, I would grade them at a 2+, and I would say that they are brisk and expected. And so I had already checked for the edema, but if I was also going to grade that, I would probably grade it on a 4-point scale. And his would be a 0 because I didn't notice any swelling. And if I had noticed swelling, I would think about possibly a DVT or maybe like chronic venous insufficiency. All right, so moving on with palpation to the chest area, I'm just gonna palpate with the pads of my fingers at multiple different parts of his chest. So the first would be the aortic, and that is at the second intercostal space on the right sternal border. The pulmonic, which is on the second intercostal space on the left sternal border. Erb's point, which is the third intercostal space, left sternal border. The tricuspid, which is the fourth intercostal space and the left sternal border. And the mitral, or the point of maximal impulse at the apex of the heart, which is the fifth intercostal space and midclavicular line. And while I'm doing that, I'm just looking if there's any heaves or thrills. Thrills are when my hand is up. It would be indicative of hypertrophy. Heaves is my hands would go up. Thrills would be a palpable vibration that would signify something like rapid blood flow. And so after palpation, I'm going to start moving on to percussion. So instead of that, I'm just gonna actually have the patient go on his left, and I'm just gonna palpate at the mitral area, palpate at the mitral area again. So I'm just going at the point of maximal impulse. All right. It's just better to get a good, there I should feel like a ventricular pulsation or tapping on my finger. So I didn't feel any heaves or thrills on Mr. Perez. And his API felt normal and brisk when he turned on his left. Now, had I felt this in maybe like a different area, I would have considered a left ventricular enlargement, or if there had been increased force, I might have thought of left ventricular hypertrophy or aortic stenosis, it could even be, but I didn't. And it can actually change positions in pregnant women as well. But the duration and the location were both normal, and neither of those findings is something that I would consider. So finally, I'm just going to conclude my cardiovascular assessment with auscultation. And again, I'm going to be going in the aortic, the pulmonic, Erb's point, tricuspid, and mitral areas. And I'm just going to be listening for S1 and S2 sounds with Mr. Perez both laying down and also with him sitting. And I'm just going to be assessing for any heart sounds or murmurs if they're present, or maybe like an S3 or an S4, which could be heard again with the left lateral position. So S1 and S2 and even S4, those should be listened to with the diaphragm with the stethoscope. Low pitches are best heard with the bell, and then high pitches are best heard with the diaphragm. So I'm going to do both, starting with the diaphragm. If you could just turn on your left side for me. right, and if you could just sit up for me. Again, the aortic, pulmonic, Herb's point, tricuspid, and mitral. All right, so with all the positions, all the sounds that I heard were normal. Now, if I had heard a murmur, I would have used the carotid artery to dictate if it was either systolic or diastolic. Systolic murmurs, those are going to coincide with a carotid upstroke. And I would have also described that murmur by its quality, whether it was hard, musical, rumbling, its pitch, whether it was high, medium, low, and again, whether it was systolic or just diastolic. But again, I didn't hear any of the murmurs. And then in all the positions, I heard the S1, which is the closure of the AV valves. And I also heard the S2, which is the closure of the semilunar valves. Neither of them, those sounds sounded extenuated or diminished, which could be a sign of increased fluid, air, and there was no splitting between the S1 and the S2, which I was assessing for in the pulmonic area. Again, no murmurs, and so that's a good thing because with murmurs, while they might be innocent, they could also be a result of turbulent blood flow or even regurgitation. That would conclude my cardiovascular assessment. Mr. Perez, do you have any questions for me?
No, thank you.
All right. That's it then. Thank you.